In. Enter the room.
You can start, Doctor.
Hello, good morning. Hello, good morning. My name is Dr. Antonio. I'm one of the junior doctors working in this respiratory unit. Could you kindly confirm your full name for me, please?
My name is Natalie Tate.
Oh, I'm pleased to meet you. How would you like me to address you as during our consultation?
You can call me Natalie, Doctor.
All right, Natalie. Could you also confirm how you're related to one of our patients here, Hilary Tate, 70-year-old female?
Yes, she is my mother.
Oh, pleased to meet you. So could you tell me how she came in to be admitted here with a cough 2 days ago?
Yes, Doctor, I was meaning to talk to you about that, and I'm really upset to know that, she was recently diagnosed with cancer and nobody could catch it early. I mean, it's been a while that she has been suffering, and, all of a sudden, after the fourth admission, you're telling us that this could be cancer.
I'm very sorry you're going through this. I can see that you're really upset, and I can understand how that's how a misdiagnosis like that can be upsetting. Are you comfortable enough to speak with me so that we can get to the bottom of the issue and see what's going on with her?
Yes, absolutely. I fully intend to do that.
All right. So I just wanted to know what's really happened with her to have this cough as well as the previous admissions. When did the cough start?
It's been going on for a while. She's been having it for the past 4 months, and she's gotten
Oh,
admitted for this almost about 4 times. And every time we get admitted, they just give us antibiotics and just leave us. I mean, it goes down for a while, but then it just starts getting worse again.
oh, I see. I'm very sorry you are going through this. I'm sure it's quite distressing for you, but I just wanted to know if in the previous admissions you noticed Hillary to be having any coughing up of blood or any weight loss.
I feel she has been losing weight actually. It's been
Okay.
I think past 2 years her clothes are kind of getting loose, but she's not been coughing
Okay.
any.
All right. Did she complain of any chest pain or difficulty in breathing over this period of illness, over these past 4 months?
I mean, she has been having difficulty in breathing, especially since she's been having this COPD. She's had it for a
Okay.
while.
All right. How long has she been treated for COPD?
I mean, she's had COPD for like 20 years, and she's on inhalers for that.
Okay. Which specific type of inhaler has she been using over these past 20 years?
Yeah, I'm not sure, doctor. The brown one, I guess.
All right, I see. I'm very sorry you had to find out about this whole diagnosis this way, but I just wanted to ask you a few questions regarding your health before we get to the bottom of the issue. Does she take any other medications or being treated for any other illnesses?
No.
Okay, and have you noticed to be changing in a mood or a day-to-day function?
Well, she has been very distressed lately, especially since she's been having this infection and this cough.
Okay. And throughout all these admissions, was she also experiencing a high temperature?
Yes, she was, in fact. She was having very bad fever.
Okay, I'm very sorry to hear that. And you mentioned that all these other admissions, she was getting antibiotics. Did she get any other medication to take at home?
Yes, she was on paracetamol.
Okay. And how was that paracetamol helping her, in your own opinion?
I don't know, I mean, it worked to bring her fever down, but then she still had all her issues.
Okay, I can understand that. And I see that she has been having a history of smoking 40 cigarettes a day. How long has she been smoking for?
I don't know. It's been a while. And she can't quit. She tried. She's never, managed to quit.
Okay, I can understand that. So has she been managed formally at a smoking cessation clinic or see someone about the smoking?
I mean, she tried to quit, and it wasn't possible for her, so she never tried again.
Okay, I see. So do you have any idea what could going on with all these symptoms and this new diagnosis that we've made?
Yeah, that's what I'm here to find out. Like, why didn't you make that diagnosis before? I mean, she has been repeatedly coming to the GP and they haven't done anything to just give her antibiotics. I mean, why wasn't it detected before? Why didn't they do the required tests?
I'm very sorry you had to find out this way, and I can understand how that's really upsetting for you and your family. But I would like to know if you have any specific concerns about what's going on.
Yeah, I'm really concerned about her health, and I'm really concerned about the antibiotics that were given to her. I mean, I'm concerned that could have caused this cancer.
I can understand that. And what I can assure you is that as of currently, there is no evidence that really shows that antibiotics have a directly cause cancer. But after I get more information, we could find out a solution to what's bothering you, to what's going on with her. What do you hope we could do for her today?
2 minutes remaining.
Yeah, I'm hoping to actually, make a complaint against that doctor, for what he's done, what he's put us through. You think he'll help if I make a complaint?
Well, there are ways for you to make a formal complaint. I could refer you to our patient advisory liaison services, the PALS, and furthermore, I'll go on to make an incident report so that I communicate better with my seniors to let them know about this unfortunate event that you're having. And again, I truly apologize for what you're going through. But what I'll also assure you is that currently she's under the best care of our oncologist. Do you understand what I'm explaining to you?
Yeah, but do you think that the doctor should receive any punishment for what he's done?
Well, honestly, I'm not in a position to be making that conclusion. But what I can assure you is that I'll definitely communicate with my seniors so that they can assist you fully with what's going on with Hilary. Is that okay?
All right, fine, sure. Is my mother going to be all right, doctor?
Well, what I can assure you from this point forward, she's under the care of our oncologist. So there are ways in which we'll do further investigations to see exactly if the diagnosis of cancer that we've made is the correct one and at which stage you've picked it up. Because as you know, due to a long history of heavy smoking as well as the COPD, those might have also contributed greatly to what she's experiencing. But I'm very sorry you had to find out this way, and I will indeed make an incident report about this.
Yeah, I just don't understand how there could be such callousness when it comes to cancer. I mean, you've put the whole team has put my mother and me through.
Move on to the next station.
All right.
Wow.
Yeah, I know this is a very difficult case indeed. Yes, absolutely.
Yeah.
Also address the fact, why there was a delay in such diagnosis, right?
Diagnosis. Okay. Okay. I forgot that part. All right.
Like, why was there a delay? Like, what could be contributing to such a delay? But good job, doctor. I mean, towards the end, when you're closing the case, especially when you know that there is only 2 minutes left, try to bring in the leaflets, try to bring in a follow-up, try to bring in
Okay.
right?
All
So,
right. All right. I got it.
definitely talk about all those aspects. That will just give you some, extra marks for the management itself. But as soon as you hear the 2-minute bell, start wrapping it up. Okay. But
Okay.
awesome.
Thank you.
So let's quickly look at the leaderboard for who is going to be our next candidate. So thank you everybody for answering the quiz. And I will just be opening the leaderboard for you guys.
So, Dr. Farah, I just wanted to tell you one thing. So when you asked about the smoking cessation clinic, in the beginning. So instead of asking that in the data gathering, which you already have so much of things to do in the data gathering, right? So instead of that, try to push that in management. So has she tried any smoking cessation clinic or any resources for that? Instead of that, if you had just directly used that in your management, where you could have said, we can help her with her smoking cessation, where we can offer her resources that she feels. So that way you'll get another point in your management instead of wasting more time in your data gathering. Whatever she answers in your data gathering is not going to help you unless you bring it back in your management again.
Yeah.
Okay, thank you.
Point. So yeah, definitely understand where you need to bring the points in management and when you need to start the management. All right. So that is the score. So our next candidate will be Dr. Rian. Dr. Rian, are you there on the call? Is Dr. Rian there on the call? All right. Until Dr. Rian joins, we can actually discuss the score for Dr. Farao. So let's see how the second try went. Awesome. All right. So this time, the identifiers, you got the identifiers correct. Make sure to understand the relation as well. Clarify the purpose for today's conversation. I think you skipped over to, talking about the consultation right away. Ask about the onset, duration, and progression of the course. Ask about shortness of breath, when it started, what's worsening it, if there was any hemoptysis, chest pain, any lung-related symptoms. Yes, that was good. Paraneoplastic syndrome, yes, no, either ways, right? Ask about the frequency and duration of the GP's visit. So you need to understand in your mind, like, how often was she getting this, infection? How recurrent was it? Understand the admission, the need to go to the GP, understand how many times the antibiotics was given, right? Get a proper timeline for those things so that you can actually say that these are all contributory factors that led us to evaluate for a possibility of cancer, right? Assess the impact of symptoms on daily activities and overall health. Good job. Ask about systemic symptoms like fatigue, unexplained weight loss, night sweats, loss of appetite, current medications, past medical history, smoking history, ice. So good job on that. Management, validate emotion, acknowledge and empathize with the daughter's feelings of anger and frustration. Yeah, I think you managed to do that this time, so good job. Explain her mother's current diagnosis in simple words. I think I'll give you a partial for this one because you didn't understand the different, how they actually came to that cancer diagnosis. Right? How was this diagnosis made? What was done to make this diagnosis, right? So understand a little bit about what was done for her in this current admission and how did you find out that she has cancer, right? Explain that COPD and heavy smoking are significant risk factors. You don't know that that has caused her cancer, but you know that those are risk factors. Those are actual facts that you know. So definitely mention them, right? As since she has had COPD and she has been smoking, these are very significant factors, and they are known to cause cancer, right? Not
Yes.
caused a cancer. That's not something that but it's known to cause, right? So discuss the possible reasons for delay in diagnosis. That was the issue. Why is there a delay in diagnosis? That was her issue, right? So understand the case properly for that. So clarify that antibiotics do not cause lung cancer, death, or I'll give you a full for this one. Explain next steps, oncology team involvement in further staging and investigation. Ensure appropriate care under the care of oncology team, provide necessary support and treatment, address specific concerns, encourage filing a formal complaint with PALS, a thorough investigation. Inform her, you will file an incident report to ensure her concerns are addressed systematically, document the conversation thoroughly in the patient's note for the team communication and informing seniors. Reassure, ensure that the daughter and her mother will receive the best possible care moving forward, right? That this kind of a mistake will not happen. We will evaluate for everything, right? Follow-up, schedule follow-up, safety netting, leaflets, pamphlets, that's something that you can actually offer her. Counseling, that's also no. So you understand that the mother is gone through a lot of distress, so you can actually offer that, right? Like especially when there is a cancer diagnosis, definitely you need to support the individuals with such a diagnosis. So give the, support groups, the Macmillan Care Centers, refer them. Otherwise, yes, Dr. Rohit is marking great for all the interpersonal skills. Acknowledge the daughter's emotions, express empathy, use simple terms, check for understanding. Yes, the patient-centered approach, active listening. Yeah, this time you actually didn't interrupt me, so that's good. And reassure, offer her hope and support for further care of the patient. So good job over here. Also, I think issues, yes, that was definitely missed. You need to address the fact, what the issue is, and management and time. Yes, you had a lot more to talk about. But good job, Dr. Farao. I think that there's been a great improvement.
Please like and subscribe to Turing Med School. Good luck with your preparation.